Dear students, my name is Jordan Simeonov, and in this video presentation, I would like to give you basic information on the chronic and long-term effects of pesticides on human body. We shall concentrate on the following adverse effects on humans: pesticides and cancer, reproductive toxicity, congenital malformations, delayed neurotoxicity and immune system suppression by exposure to pesticides. Epidemiological case control studies has shown a higher risk of malignant diseases of the hemopoietic system, such as lymphoma, leukemia, and multiple myelomas, after professional exposure to herbicides and insecticides. Carcinoma of the testis, gastrointestinal organs, liver, and the brain have been observed in farmers. There were also cases of cancers in children whose mothers have been exposed to pesticides. Occupational exposure to fumigants during production and application could cause sterility, azoospermia, and oligospermia. Sterility, spontaneous abortions, and stillbirths are more frequent in cases of excessive exposure to pesticides of both parents. Well documented are the links of professional exposure to pesticides and cases of delayed neurotoxicity, congenital malformations, and the general cases of immune system suppression in causing allergic reactions, immune suppression, and autoimmunity reactions. This is the title page for presentations of the Erasmus Project ToxOR Learning Toxicology through open educational resources. And now let us go back on the topic and include some more details. Depending on the time of pesticide exposure, two different types of toxicity are distinguished. Acute toxicity, defined by high dose within short period of time of exposure. And chronic toxicity, defined by low dose within long duration of time of exposure. The picture of acute poisoning with various pesticide groups is more or less typical and familiar and well described in specialized literature. On the contrary, the knowledge about chronic effects is rather limited. The main reasons for the rather limited knowledge of chronic toxicity include issues as the potentiality of health damage is by analogy to findings in experiments with laboratory animals, the existing reality of combined and consecutive exposures to several or many different pesticides in one season or during the whole period of service, the difficulty to complete a documentation of chronic and long-term effects during the whole period of clinical manifestation, particularly for cancer diseases, the non-specificity of the possible health effects which follow pesticides exposure. This presentation will concentrate on the following adverse effects on humans, and only indirect evidence for eventual cause-effects relationships will be discussed. Pesticides and cancer, reproductive toxicity, congenital malformations, delayed neurotoxicity, immune system suppression. Pesticides and cancer. Malignant diseases have been recorded after professional exposure to herbicides and insecticides in workers engaged with pesticide production and in farmers who have worked as sprayers. Evidence of carcinoma of the testis, of the gastrodigestive tract, the liver and the brain has been documented. Cases of cancers in children whose mothers have been exposed to pesticides in their home and garden have been documented. These are cases of neuroblastoma, cancer of the rectum, of the brain, and aplastic anemia. Occupational exposure to some fumigants during production and application has caused sterility, azoospermia, and oligospermia. Reduced fertility has been observed in workers in the production of the fumigants DBCP and ethylene dibromide. Sterility, spontaneous abortions and stillbirths are more frequent in cases of excessive exposure to pesticides of both parents. These data are mainly from observations in workers in grape-producing regions. Congenital malformations. Reports in literature discuss cases of congenital malformations due to occupational or general exposure to pesticides of women during the first 3 months of pregnancy. Epidemiologic investigations indicate the defects in the progeny, such as anomalies of the limbs, fissures of the palate and the upper lip, malformations in the central nervous system. In a study of parents working in flower glass houses, higher frequency of negligible defects such as subcutaneous hematomas is registered. Delayed neurotoxicity. Some organophosphorus pesticides can induce the so-called delayed neuropathy. The neural fibers with great diameter and length in the spinal cord and in the peripheral neurons system are injured. This leads to muscular weakness, which can progress to paralysis. Most often the lower limbs are affected. Deviations of neurobehavior reactions, such as restlessness, difficulty to concentrate, weak memory and others, are reported in cases of previous acute poisonings by organophosphorus pesticides. Data about such disturbances at low levels of chronic exposures are not confirmed. Immune system suppression. Toxicological investigations indicate that human immune system can be attacked by long-term exposure to low doses of pesticides. The most important function of the immune system is to ensure protection against infections of viruses, bacteria, fungi, parasites, as well as against cancer cells. The organism's protection is called immunity, Latin word which means free of, and displays two main types of protective mechanisms, non-specific and specific. Non-specific protective mechanisms include the participation of lysosomic enzymes, which suppress the development of microorganisms, interferons for protection against viruses, as well as absorption and digestion of the alien to the organism bacteria. Specific type of protective mechanisms are characterized by recognition of the infectious agent and development of immunologic memory. The specific immune system consists of central lymphoid tissue, including bone marrow and thymus, and peripheral lymphoid tissue, spleen, lymph node. Immunotoxicity of the pesticides. Some individuals exposed for a long time to low pesticides doses can develop certain reactions on the part of the immune system. The damaged immune response can be of 3 types. Enhanced sensitivity or allergic reactions, suppressed reactivity, immune suppression, or reactions of the organism to its own components, or autoimmunity. At the end of the presentation is the closing page of the TOXOR project, where you can see the logos of the participating educational institutions from 7 European countries.